Thank you. Good afternoon, everyone, and welcome to the fourth webinar of the San Diego Foundation series, Better Together. My name is Brian Zambano. I'm the Vice President and Chief Development Officer here at the San Diego Foundation. Apologies, I'm not Mark Stewart, the CEO of the Foundation. Mark will be joining us shortly and is just handling some Zoom issues, which I know we're all appreciative of and probably sympathetic to as well. But we're so excited you're here with us today. It's July 1, which is not only the midpoint of the year, and I think all of us are looking forward to probably a better second half than the first, but it's also Canada Day, and happy Independence Day to all of our friends in the North and the Canadians among us. But most importantly, for any nonprofit operating on a July 1 through June 30 fiscal year, this is Reset Day. This is the day when all of our KPIs and metrics all start back at zero. It's also time we close the door on the past fiscal year, either by celebrating or saying good riddance, and begin anew and fresh for the fiscal year 21. So good luck to everyone on a great fiscal year 21, and we have a lot to cover in this hour, so let's get started. Our agenda here gives you a sense of the diversity of topics we'll dive into today. We also are honored to have 5 great nonprofit leaders joining us, and it has been a pleasure to learn of their work through our COVID-19 Community Response Fund. At the end of hearing from all of these great panelists, we'll also have a Q&A at the end of the webinar. If you have any questions, please do ask them, and make sure to use the chat function. I'm sure all of us have come to know in the last 3 months of all these constant Zoom meetings. All of us at the San Diego Foundation have been honored to be part of the San Diego COVID-19 Community Response Fund, and the incredible support it's garnered by individuals, foundations, corporations, as well as other entities that wish to make a difference through our collective actions. Our goal from the beginning of the fund was to raise as much money as we could and get it out as quickly and as impactfully as possible. I hope we're all in agreement we hit that goal, but we continue to do those efforts and continue to try to get additional funding out the door. But as you know, our work is not finished, not by a long shot. The need in our county is so great, and it's going to be with us for some time. It really does feel like we're at the confluence of crises, and those who are hurting in our county need our unified help and resolve now more than ever. So let's begin with Kim McDougall from the Y. Kim, I'll let you know when you have about a minute left to complete your presentation, but thanks for being with us and look forward to hearing your thoughts.
Great, thanks Brian, and thanks for the invitation to be here today. Good afternoon, my name is Kim McDougall and I'm the Executive Director for the YMCA Childcare Resource Service, which going forward I'll refer to as CRS because can't get through something without acronyms, right? For 40 years, CRS has been the state-funded resource and referral entity for the County of San Diego, which means we have been connecting families with childcare, providing families with financial assistance for childcare services, and supporting the quality and viability of childcare in the county over that time. This afternoon, I'm going to share a little bit with you about our early care and education community's collective response to the COVID-19 pandemic. Next slide, please. Thank you. So immediately following the stay-at-home order in San Diego County, CRS leveraged our longstanding community partnerships, and we were able to pull together a region-wide task force of over 25 community-based organizations connected to childcare. The goal of this task force was to make childcare policy and practice recommendations to support the community in the face of all that was happening, the economic uncertainty, school closures, and government orders. But it quickly became clear that our task force needed to expand our partnerships to those not traditionally at the childcare table. So we began to develop relationships with the Hospital Association, our local funders, unions representing a wide variety of our essential sector workforce, business development groups and policymakers, our County Office of Emergency Services and our Public Health Department, as well as our police, fire, and our military associations. And as a result of these robust partnerships and a really beautiful collaborative effort, San Diego County has been able to formalize a county-level Office of Emergency Services Childcare Disaster Council, which really helps open lines of communication between the Office of Emergency Services and the childcare field, as well as helps formally incorporate childcare into the county-wide emergency response plan. Second, we were able to secure the first ever county funding to support childcare for essential workers, which was then matched by the city of San Diego, resulting in $10 million in CARES funding for essential services, for childcare services, excuse me, for essential workers. So they were able to access care while they were, still supporting us on the front line. We've been able to coordinate resource hubs throughout the community to distribute over 1,500 supply kits to childcare providers with essential things like bleach and PPE and learning materials that they've needed. We've been able to, in partnership with one of our very close partners, Child Development Associates, secure and distribute over $1 million in philanthropic support to families and childcare providers throughout the crisis. And lastly, we have been able to administer over $3 million in resource support funding for providers to cover the added costs associated with COVID-19. Next slide, please. As we came together as a coalition, something that became immediately clear to us was that we really needed to elevate and protect our existing childcare infrastructure as a support to our essential workforce rather than setting up pop-up childcare sites. Our approach to utilizing this existing infrastructure was informed by a real-time assessment of our childcare capacity throughout the duration of the pandemic and continues today. This was completed by our team at CRS, and data was collected twice a week directly from open childcare providers, as well as we had daily communication with our community care licensing entity, which is the childcare licensing entity for the county, providing us information on open and closed childcare facilities. Our childcare referral database was then updated with real-time data so that we were making referrals for essential workers that really were available. They were targeted, they reflected slots that were immediately available, and they met the needs of these very diverse schedules that our essential workforce were being asked to work. And additionally, zip code specific capacity reports were provided to the County Office of Education to help inform their decision making as they tried to figure out if they should be opening school-sided childcare and what the needs of their families were. This data was then used to create a weekly need and capacity report that you'll see on the screen that was then shared with local policymakers and decision makers to really help bring home the point that we have a very strong childcare infrastructure. We just need to preserve it, and we need to fund it to the level that it needs so it can survive this pandemic. To gain a greater picture of childcare needs beyond just what we were hearing from parents on our referral lines, we collaboratively developed a childcare needs survey that was managed by the County Office of Ed and deployed by our council members and went out to our hospital systems, our labor unions, government and public health sector workers, our military and Navy, fire, police and emergency medical response, food service workers, and the vast array of essential sector groups that still needed to report to work every day yet needed care. Thousands of survey responses were received, and then each school district was provided an individualized data report that really reflected the childcare needs of the families in their respective districts to help their decision making. And as a result of this great data that we were able to capture, we are able to continue to elevate the message that childcare really is an essential support for our community. And as essential sector workers, childcare providers are still out there on the front line supporting all of our community. Next slide, please. As we've worked to influence systems of support for our families and for our providers, we have continued to perform our essential functions as the childcare resource and referral in enhanced and innovative ways. It's been very exciting for us to try some new things. We've been able to, as I mentioned, provide those really targeted referrals for our essential sector workers. We've been able to move all of our childcare voucher distribution to electronic signatures, and all of our grant funding we have been able to move to electronic signature process. We've been acting as the information hub for childcare providers. There have been a lot of changes around county and state regulations. There's been some confusion on behalf of providers, and so we've been able to really help them understand the new information as well as provide technical assistance. And then we've been able to participate in very strong communication with our County Emergency Operations Center to really ensure the voices of childcare providers were being heard. And then thanks to really generous funding from organizations like the San Diego Foundation, in partnership with Child Development Associates, we processed over 3,300 microgrants to parents and childcare providers to cover costs of groceries, utilities, diapers, increased childcare costs for families, and reduced wages for providers. Next slide, please. Thank you. As a result of securing this $10 million in childcare funding for essential sector workers and providing enhanced referrals, we were able to support essential sector workers in continuing the fight against COVID-19 from the front lines. Like many of our essential sector workers, Melissa Villegas, a registered nurse at Kaiser Permanente, was one of the clients that we supported. She was faced with a childcare crisis for her 11-year-old son and 18-month-old daughter. Her schools closed, her family was unable to provide care for her, so she had to make the hard decision to go on unpaid leave from the hospital for the whole month of April until she could find a way to pay for and secure childcare. Childcare can cost as much as $16,000 a year, which Melissa could not afford, and with her inconsistent schedule, finding care really seemed to be impossible. But after receiving a childcare voucher, CRS helped her navigate her childcare options, and we found a provider for her that fit her needs. Within 7 days of applying for funding, she was dropping her kids off at a family childcare home near her house on her way to work at the hospital. Melissa shared with us, if I didn't have this childcare, I probably would have cut my hours. I would have had to take a pay cut. It's nice to have the support because it's a time of uncertainty. As an essential worker, I fear going to work sometimes. Just having someone reliable and knowing my kids are in a safe home and that they're having meals provided and are happy makes a big difference. Next slide, please. So childcare has always been a really critical piece of our community and the infrastructure that supports our community. Yet we now know that it is also a very critical part of our region's recovery. Our childcare providers, though, are continuing to struggle to keep their doors open. Many providers are on the brink of losing their businesses after they've exhausted their savings. They have not been taking pay themselves from many of the owners of childcare centers. The future really continues to be uncertain, and with decreased enrollment and increased costs that they're facing associated with these new realities that we're functioning under, you know, really we are at a critical point for supporting childcare and making sure that it continues into the future. So alongside of all of our really engaged community partners, we will continue to focus on how do we ensure we're maintaining the health and safety of childcare as it reopens, looking at childcare businesses and how we help them access financial supports that are needed to get them through this time and remain in business, you know, over the long term. We will be looking into conducting in partnership with the county a testing, treating, and tracking pilot in childcare to understand how COVID is spreading throughout the childcare setting. Really looking to support children's social and emotional health. We know that children have been through a lot in this pandemic, and as they transition back into childcare, there's going to be a lot of need. And then providing continued advocacy for increased provider rates, diversified funding stream for childcare, which has always been needed, as well as a childcare bailout, which is being considered at the federal level. So although we know it's a really long road still to go for childcare and for all of us in this COVID-19 adventure that we're on, you know, we are totally committed to ensuring that we're continuing to innovate and provide ways to support our childcare providers as they continue to support the other essential workers in our community. That was all for me. Thank you.
Thank you so much, Kim. And this already sees some good chats going on in our chat section. And for our attendees, please do, if you hear one of the speakers say something you'd like to follow up on later or ask a question, please put it in the chat. And as you're thinking of it, we'll make sure to view them as we move forward. And when we get to the Q&A part, we'll make sure to get to your question. So up next, talking about the digital divide, we have James Wright, the CEO of Classroom of the Future Foundation. James?
Thanks, Brian. Good afternoon, everyone. The Classroom of the Future Foundation is a nonprofit that serves all 42 public school districts in San Diego County, as well as the San Diego County Office of Education. Our mission as an organization is to unite business community and educational leaders to create innovative learning environments that prepare our students for the jobs of the future. We have a 23-year history as an organization of creating innovative learning environments, working hand in hand with our school district partners. And each year we're serving tens of thousands of students with college and career readiness programs, innovation grants, STEM scholarships, and most recently, connectivity support. We provide grants provide direct services to our districts throughout the year. And then we do a lot. We see ourselves as a connector, bringing the local business community together with our school districts to support the needs of our kids. Next slide. In March, we, like every nonprofit in our country, had to pivot, and as our school districts physically closed and moved to new distance learning initiatives, it put a huge spotlight on a problem that had already been in existence for a long time, and that's the digital divide. Too many students in our county lack internet connectivity in the home or lack consistent internet connectivity. And so our organization, in partnership with the San Diego County Office of Education, and before I go any further, I should mention that we have Dr. Patrick Geddes-Rabungo on the call. He's the Chief Innovation Officer at the County Office of Ed and my counterpart there. And so if you have any questions, please chat them and he'll be more than happy to respond. But in working with Patrick's team and the great people at the County Office of Ed, we verified and conducted a needs assessment to really determine what is the current gap in connectivity around our county. And what we learned was that 1 in 5 students today lack connectivity in the home or lack consistent connectivity. That's roughly 100,000 students, and this gap is even worse in our South Bay, in our East County, in our North County. Just in our South Bay, for example, about 65,000 students lack connectivity. In addition to this lack of connectivity, there's also a tremendous need still for devices. Many of our school districts have done a great job with getting Chromebooks and iPads and other devices out to kids for distance learning, but there still is a gap. And one of the other items we verified during this assessment was the fact that there are still hundreds of students in our East County, in our more mountainous rural districts that live beyond the reach of a cell tower. So when we talk about delivering broadband or providing these students with a hotspot, a mobile hotspot, it's not going to work for these kids. We need to provide them with internet, satellite, or microwave services to keep them online. There truly are long-term consequences to the digital divide. The FCC has reported that students that have internet access have an 8% higher graduation rate. So students that don't have regular access to the internet are less likely to finish high school, less likely to go to college, finish college, and less likely to earn that family supportive income that they need in their future. And at CFF, we truly believe that having connectivity should be seen the same as having access to electricity or water. Every student deserves to have full access to high-speed, reliable broadband so that they can continue their education at home during distance learning. So in response to this needs assessment, the Classroom of the Future Foundation developed an initiative. We call it our Public Education Response Fund, and it's our goal to serve at least a third of this digital divide in our county, provide a minimum by the fall of 30,000, connect a minimum of 30,000 students, and begin to bridge this digital divide by providing low-cost broadband in partnership with Cox and Charter Spectrum and other providers, providing mobile hotspots in partnership with carriers like Verizon. Mobile hotspots can be a much better solution for certain student populations, such as our homeless youth or our foster youth. We also need to ensure that when we provide these connections, that students have the bandwidth that they need to actually be able to have success doing their Zoom calls with their teacher or accessing their learning management system. And so we're so very grateful that the community in recent months has stepped up, and in particular the San Diego Foundation is and its San Diego COVID-19 Community Response Fund has provided a tremendous grant that will allow CFF alongside the County Office of Ed and school district partners to provide connectivity and devices to 20,000 students by the beginning of the next school year. And it's really our goal to keep, once we provide these connections, keep these students online through the academic year so that these families do not need to worry about their internet bill or connectivity, and their students can continue to engage in distance learning, because it's more likely than not that distance learning is going to be with us in some fashion in the fall. And so we're so very grateful to the San Diego Foundation and our other donors that have stepped up. In addition to this work, we also have an eye on recovery and resilience, and we've been fortunate to partner with a lot of other nonprofits, San Diego for Every Child in particular, to put together a task force very similar to the one that Kim shared regarding childcare, to begin to build out a recovery model so that we can address this digital divide long term. And it's just so critical that we have a long-term plan to keep students online. And this coalition includes not just nonprofit partners, but our school districts, the San Diego County Office of Ed, who's taken a leadership role, philanthropy, corporate partners. I want to end, next slide, please, with just a picture of two brothers. This is Michael and Luke. They were students. They're students in the juvenile court and community school program in the North County. Before March, they were using paper and pen to do their schoolwork. And thanks to the generous support of our community, they now have Chromebooks. They now have internet connectivity in the home, and they were able to finish school last month and succeed academically. Next slide. This next student is Jasmine. She's a student at Lindsay Community School, and like Luke and Michael, she did not have a Chromebook. She did not have connectivity in the home. This is a picture of the backpack distribution that occurred, shortly after the school closures, where the San Diego County Office of Education was able to provide Chromebooks and connectivity to students like Jasmine in JCCF. So thank you again to everyone listening, and to the San Diego Foundation for inviting CFF to speak today.
Thanks so much, James. Next, to speak on financial assistance is Ramla Sahid, the Executive Director, Partnership for the Advancement of New Americans. Ramla.
Hi, everyone. Really appreciate the space to be able to give this update and for the opportunity to present alongside all of our amazing partners. I want to first, if you can go to the next slide, share a little bit about who we are. Next slide. Our work at PANA is really focused on ensuring families who have fled violence and persecution are on a path to meaningfully rebuild a sense of home in this country and achieve economic and social belonging. We invest in community organizing to build power for refugee communities, and with our community, using and utilizing an integrated voter engagement approach and policy advocacy to bring about the change that we seek. We do this work and organize our work in two main buckets. The first is the regional bucket. This is how we ensure we stay true and responsive and accountable to our community. Our organizers and community leaders facilitate localized campaign efforts to push. For example, we have been working with City Council around tenants protections. Yesterday, there was a huge mobilization around extending the eviction moratorium. So that's what I mean when I say localized policy and campaign efforts. This regional work also informs and is translated into how we engage at the statewide level, which is our second area of work. Our communities, so we serve communities from the Middle East, Southeast Asia, and Africa. Families who are being resettled because they're impacted by war and violence and persecution. And so our communities, of course, are impacted by issues of racial profiling even after resettlement. So here in the US, right, here in San Diego, they're impacted by issues of racial profiling, religious discrimination and Islamophobia, and increased government surveillance. But they also see barriers to healthy housing, family-sustaining jobs, and quality education. And COVID-19 is both exposing and exacerbating these societal inequities. Next slide. What we know in our community after working with refugee communities for the past 6 years is that our communities have already been having a difficult time managing and trying to keep up, right? And keep from falling further behind. Our families are among the hidden homeless, and by that we mean families who are doubling up and tripling up, maybe have an informal or no lease at all, as a way to maintain housing and a roof, as a way of maintaining housing and a roof, because that is the only way that they'll be able to afford it. And so it's not uncommon not to only see folks who are cost burden, meaning they're paying, traditionally we talk about affordability as like if you're paying more than 30% of your income on housing, then that housing is, your cost burden. Our families, it's not uncommon to see 50% upwards to 84%, 60% of their incomes going to rents. And so managing the housing crisis in San Diego for them actually means, being creative and figuring out ways for families to team up, if they will, based on, either family connections or even just shared language to house multiple families. Our families, so this is just a slide to kind of show you a past report we did that also kind of overlays education level. So of course, you would think, the more education you have, the better job opportunities you're exposed to, and as such, your housing costs are more and more affordable with your income. Even when our families have, and go to the next slide, even when they have graduate degrees, when they've got bachelor degrees and they're educated in the US, and San Diego State, we've had a lot of folks that we've interviewed who graduated from San Diego State who are driving Uber, who are driving taxis, who are unable to in any meaningful way break into the workforce in our local region. And we call that kind of the perpetual outsider syndrome, because our communities don't have sort of the meaningful connections and opportunities exposed to them to sort of get their foot in the job, get their foot in the door for these competitive jobs. Next slide. So COVID-19 really is, like I said earlier, both exposing and exacerbating these societal inequities our families face. This has resulted us in pausing some of our work to really plan and think through how what our approach will be to kind of respond to family needs, and make urgent shifts in our work to also allow staff to respond to their needs, their families. PANA really prides itself to hiring from the communities in which we serve. And so, of course, knowing both our communities are going through the challenges of COVID-19, but our staff members are as well. And so making space for that adjustment to occur. We launched the San Diego County Refugee Emergency Fund on March 16th, actually. So very quickly, we got on a call as a team and decided we're going to relaunch a program which we started back in 2015 and rename it as the San Diego County Refugee Emergency Fund. As of today, I'm really happy to report that we've raised over $244,280,000 to provide families with direct cash assistance, including $200,000 to support our 11 refugee-serving ethnic-based community organizations in which we often collaborate and work together with. We think a regional approach is really critical at this moment to ensure that we're reaching as many of our families as we possibly can, and that we're doing it in ways that is not duplicating services or replicating something that another partner is doing. So really being intentional about collaborating and working together to identify where there may be gaps that exist. The fund that we have provides one-time grants to families who are impacted So this is, either emergencies related to COVID-19, like reduced work hours, furloughs, dealing with job loss, complete job loss, and other challenges, but it could also be other emergencies. And we've had people who've come to us because a family member has passed away and they needed help with funeral costs and things like that. So it could be both COVID related and just the circumstances don't allow them to be able to afford whatever that emergency or urgent request is. And so we make these resources available to community who are in need based on family size, based on the availability of resources that they have available to them as a family, and we determine what the financial need is. Our average grant is about $526 per family, and the maximum grant award is about $1,000, although we've had one or two families who may have gotten $1,500 or $2,500 because the need was just so great and it was important for us to step in that way. As we are doing emergency support and responding to families in need, we've also created this by default, a virtual clinic to support individuals to apply for other types of benefits. So EDD benefits and other services, including IHSS services, making sure folks who, we've gotten reports where individuals who have like 24-hour care needs, hours have been reduced, for example, and so helping them through the process to go to administrative hearings and appeal it so that they're allowed the hours that they need to actually take care of the individual. This has allowed us also to create a really powerful network of community members and people that we're connected with throughout the region, right? So we're able to identify and micro-target our communities for other things like census education, for example. To date, we've granted $174,697 families to dollars to about 332 families. So the slide is slightly updated because every day we're doing work and every day we're updating our list. So here's what we're learning though about the unique challenges our community, the refugee community, is being impacted, how they're being impacted by COVID-19. So what we're learning is refugees who relied on the informal economy to make ends meet do not qualify for unemployment and other wage replacement programs, right? And so these families who had the side hustle, maybe a mom was cooking from her home and catering, and that was her source of income. When that has dried up or disappeared, she can't go and apply for EDD benefits. So how do we replace those incomes? And those are like issues that keep coming up as we engage the community and work with them. Many of our families, just the previous presentation, we're talking about the digital divide. That is very real. Families don't have email or access, they don't have access to internet, are unable to fill out complicated application forms that require uploads, right? And so we need to do some education within our sector, but also with government around how we help meet the needs of families who may not be able to, have complicated file uploads for certifications for services that they critically need. And so figuring that out is going to be important moving forward. Families, I mentioned this earlier, are among the hidden homeless. More and more families who, can't show us, for example, what their rent is. I'll just end with just saying that this moment demands us to be brave and courageous, and we should figure out ways for families to build wealth. This means having pathway to home ownership. We should figure out ways to help people save so that during moments of crises, folks have something in place, right, to help them come out of this a bit healthier. So we need to make investments in strategies that allow refugee communities to self-determine. And I'll end with that note. I know I'm over time. Thank you.
Thanks so much, Ramla. Next, to discuss food security is Anahid Brakke, the Executive Director of the San Diego Hunger Coalition. Anahid?
Thank you, Brian. Thank you to all of our attendees today. And especially thank you to everyone on the call who donated to the San Diego COVID-19 Community Response Fund to support the types of programs that you're hearing about today. You're welcome to put questions in the chat Our Senior Director of Programs will be monitoring the chat. She has a wealth of expertise and knowledge, and will be able to answer your questions immediately. Next slide. The mission of the San Diego Hunger Coalition is to lead coordinated action to end hunger, supported by research, education, and advocacy. To that end, we facilitate 4 collaboratives, and with the COVID-19, the occurrence of COVID-19, the Hunger Free Kids Task Force has transitioned into a Hunger Free Kids COVID-19 community response initiative. So that was what received a large grant from the San Diego Foundation, and I'll tell you a little bit more about that as we go through this. We have 200 local partners and an extensive outreach network of 400 plus agencies and aligned collaboratives. Next slide, please. Before COVID-19 hit, we already had high food insecurity in San Diego County. 1 in 7 San Diegans, 1 in 5 children. Next slide. I was just reviewing some of this research with our team, and I have to say it's really sobering. I'm sure it will not be a surprise, but right now, nationally, 1 in 3 children and youth are living in food insecure households. It's even more dire for families that have children who are 12 or younger. That rate is about 41% right now. That is completely unprecedented. We haven't seen anything like that before. That's up from 15%. The next bullet is also extremely alarming, which is that about almost 20% of moms with young children are reporting that their kids aren't getting enough to eat. So they're not even getting enough calories right now. And I think I don't need to explain in too much detail how persistent gaps in adequate nutrition for kids have devastating long-term impacts to their ability to develop and learn and thrive. Next slide, please. So I wanted to share a few lessons from the hunger relief perspective that were related to the last recession in our recovery that can be applied as we're trying to understand how long we're going to be in this kind of crisis this time with COVID-19. So I think we can safely say that when we have an economic recovery, low wage earners will not feel that recovery for another 5+ years. You know, this is again an unprecedented crisis. We've never seen this kind of job loss or income loss so widespread and so immediately. So it'll be interesting to see how this rolls out. But with the last recession, food insecurity continued to rise past the end of the recession and past what was considered, you know, well into the recovery, all the way to 2015. 2015 is when we saw the peak of CalFresh or SNAP enrollment locally, and we didn't see food insecurity levels start dropping until 2016. So it is safe to assume that we will see crisis levels of food insecurity through the end of 2021. Next slide. So transitioning to looking at solutions, I wanted to share with you what our hunger relief landscape looks like during normal times. A lot of times, philanthropy is really aware of the incredible work that our pantries and our food banks are doing with, you know, hundreds of partners and millions of pounds going out, and it is vitally important, and it is the glue that holds together the rest of the hunger relief system. But I wanted to review very quickly with you what some of those other sources of meals for people experiencing food insecurity are in San Diego. So the biggest piece of this pie is CalFresh or SNAP. Currently, any family who applies for CalFresh by the end of July will get the maximum benefit allotment. For a family of 4, that's $646, which is roughly equivalent to 12 30-pound food boxes. Going clockwise, the next pie piece is WIC. That is program for women, infants, and children, for pregnant and nursing moms and young children under 5. The next big piece, that's almost a quarter of the meals in our hunger relief system, is federal child nutrition programs, and that is primarily free and reduced price school meals. And then the orange is the amount of meals that are supported by private charities. So it's a real surprise for a lot of people when they see this. Next slide, please. So when COVID hit, we effectively lost 20% of our hunger relief system immediately when schools closed. Next slide, please. So that's part of what, for the sake of time, I cut out some slides about what we were able to do with the grant from the San Diego Foundation. I'll just share that the Hunger Free Kids COVID Response Initiative received $300,000. We have distributed 43 grants, 35 to school districts, and another 8 to community-based organizations who are getting the word out about PEBT. So thank you again for contributing to this fund. Challenges that are continuing in the hunger relief system. Number one, people don't know where to go for food assistance. We really need to work on good old-fashioned outreach and making sure that people know how to navigate and that all of our programs are connected. We're continuing to see disruptions to the food system and hunger relief system, and our most powerful hunger relief tools, the green portion, the 90% basically of our hunger relief system, we could be pulling so many more meals out of that. We have fully funded meals available while people are going hungry. So we really need to figure out how to maximize those and connect people in need to the meals that are available. Next slide, please. Bright spots and opportunities. People want to help each other. That's why you're all on this call. That's why we all do this work. And we have found that there are very strong, more informal networks of passionate resident leaders that already exist in every community for mutual aid and information sharing. So opportunities are there to continue to build the capacity, expertise, and knowledge of food assistance resources for organizations like Ramla's, for resident leaders, promotores. And we need to start creating more bi-directional communication channels so that we're working more in tandem. Next slide, please. So the other piece that's a bright spot is just the incredible outpouring of volunteer support, money, and other donations from community members to support hunger relief efforts. I think as we're going forward with this crisis, we have an opportunity to look at how to diversify our investments in hunger relief to support some things that will make our system stronger in the long run. And then because we have such strong collaborations, especially in the hunger relief community, we really have an opportunity to use investments like that to continue our collaborative planning to make sure that food assistance is available and easy to access for anyone who needs it. Next slide, and thank you.
Thanks so much, Anahid. And our final panelist of the day, speaking on medical support, is Anna Melgoza, the Vice President of External Affairs at San Ysidro Health. Anna?
Thank you. Thank you so much, Brian, and thank you for all who stayed on this webinar. I want to first start with our next slide, please. And on this slide, you'll see some of our 107,000 patients. And on behalf of them and our staff, we just want to thank all the donors that supported this San Diego Foundation COVID Relief Fund. It was because of you and this responsiveness, which is very key in combating this very just aggressive virus of COVID, that we were able to respond to the just magnified need that we have right now. Just to give you some information about who we are definitely a nonprofit healthcare provider. We're dedicated to providing high quality, compassionate, accessible, and affordable healthcare for the entire family, from pediatric to geriatrics. Next slide, please. This is our service area. So we have 1,600 team members. We love to hire from the community where we operate. Many times we are the economic engine in that community. And to date, we have 42 program sites all across Central, South, East, Rural, North San Diego County. And in those locations, we have medical clinics, dental clinics, behavioral health centers, WIC nutrition centers, mobile medical units. But I want to emphasize that we are really neighbors serving neighbors. And through that work, we were able to provide 500,000 annual visits last year. Next slide. I do want to start though with noting something very important, and I'm hoping that this is something that will repeat itself in this time, in this crisis. We were actually established 51 years ago out of a crisis. This is Carmen Martinez, one of the 7 founding mothers who worked together, organized. These were individuals that were not only raising children and working, but they had time to organize and come together and look for medical services for their children, since the crisis at that time was that the only doctor in the community was leaving, and they knew they needed health care for their children to thrive. So out of that movement, a volunteer clinic came to be, and out of that volunteer clinic, we are where we are here today. Next slide. I want to introduce you guys also to our frontline sheroes and heroes. This staff in this slide exemplify our employees who are leaving their own families at home to come and care for the families that desperately need our help. These are our essential workforce. And at the same time as we were calling on them to help us combat this virus, we also realized that they were all coming from the communities where there's a higher exposure rate, where schools were closing, and they also were trying to figure out childcare issues. They also now have the responsibility of teaching their children at home. And yes, as my colleagues mentioned earlier, they were facing the same issues that the families that they serve were facing. We have the digital divide. We actually lent computers to about 40 staff that needed them for their children. And then many of our staff live in the sandwich generation, in that they're caregivers not only for their children, but also for an elderly parent as well. Next slide. Actually, I want to go back to the map that I showed earlier. I want us to concentrate on this map. If you look at this, if you pay attention to the legend, the stars there are our clinic sites, and the darker shaded areas are where we're experiencing higher COVID-19 positive cases. So there's definitely an intersection there of economic distressed areas being harder hit by COVID. And as a result, our clinics were severely impacted. Overnight, we experienced an immediate drop in our medical, dental, behavioral health visits, upending our revenue model and operations model. And then due to CDC restrictions, we had to suspend services such as dental, optometry, and painstakingly look at our operational budget and make some very tough decisions. As a result, we also transferred a lot of our services to telehealth. We had unforeseen costs when it came to equipment, new computers. We also had to remain open for those that were in dire need of care. And as a result, in the beginning, we had already incurred about $3 million in infection control costs that related to personal protection equipment, more staff involved in frequent sanitizing, glass barriers, putting social distancing signage all around. And we also had to transfer and close some sites and refer those more to telehealth. Out of that though, however, we were able to maintain much of our contact with our patients and doing all we could to stay in communication with them via text and other forms of communication. However, as we all know, this virus spreads quickly and has spread quickly. And as of today, we are continuing to see a rise even after we've had many stay-at-home orders in place. What we're seeing though, where we operate in our service area, is a rate of 3 to 5 times higher than that of the rest of the county. For instance, National City has the highest per capita rate of COVID-19 positive cases in the county, with 382 people out of 100,000 in comparison with the county average, which is 154 per 100,000. Next slide. The testing site, please. Because of the support of the foundation, we were able, I think it's the one before that one, we were able to provide testing in National City as well as food distribution. Anahid mentioned earlier that outreach is important for food, and we were able to create many distribution sites, many within our clinics, and provide our patients who were experiencing hunger at higher rates with food through our partnerships. Can you move slides, please? There's one with Dr. Eldos. After this one, I believe. I don't know what happened to my PowerPoint, I apologize. But what we do have in our service area is one, we're experiencing what we already knew before, which was, there's a saying that says your greatest wealth is your health. Well, really for our patient families and our service areas, their health, actually their wealth is determined, their health is determined by your wealth, meaning that we are just experiencing a severe impact when it comes to the intersection of health and the economy. Many people will ask, why is COVID so high where we operate? Well, one thing I want to highlight is our patient families were struggling in a thriving economy. So even before COVID hit, we had 94% of our patients had to work 2 jobs. And so when you add COVID to that, it really is just catastrophic what our families are going through. And these are working families. The Washington Post just last week provided us an article about how income emerges as a major predictor of coronavirus infections along with race. And what we know is that in our area where we operate, we have a lot of essential employees that work. And so typically what we also have is a higher exposure rate for people who are working in the healthcare system, that are working in restaurants, that are working in construction. And so for the stay-at-home order, work from home order, that's impossible for them. The other condition that we have that someone alluded to earlier was overcrowded housing. Over 46% of the residents in our region are cost burden, which means 30% of their income goes to housing alone. We also have more public transportation utilization, 9% versus 3% countywide. And even before COVID hit, we had social determinants of health that were creating these health disparities. So already in our area, the county forecasts half of the children born would develop preventable type 2 diabetes due to lack of access of healthy foods and physical activity. We also have poor air quality concentration that makes it difficult for kids to go out and exercise, especially asthmatic kids. And then we also know that children born in some of our service area zip codes live 8 to 10 years less than other parts of the county, which makes the effects of COVID even more catastrophic for our families. I mentioned earlier that social distancing guidelines and stay-at-home work orders are difficult for our families to follow. What we find is that 2/3 of Californians who live in overcrowded homes are essential workers. So it's easier that if a worker was exposed to someone infected, it would be difficult for them to go home and self-quarantine and self-isolate, especially if they share a bathroom with 2 other families, either in an apartment or in a house with many roommates. The other challenge that we see is that it's very difficult for a parent to leave their children who aren't in school to go isolate in a hotel room if in fact their home is crowded, when it's difficult to ensure the care of those children 24/7 to someone else. However, the biggest challenge to self-quarantine and self-isolation is the fear of loss of income. Even as many are working, they must still rely on food assistance to feed the children who are home all day, and they also still have to pay for housing. They're not going to risk wanting to lose their income in order to self-quarantine. What's very key though throughout this, and that we're very thankful about, is being able to test people. We want to make sure that we're able to test as many people as we can. There's still challenges when it comes to testing. There still aren't enough testing sites. There still isn't enough incentive for people to come get tested. And then the other important angle is we also want people to continue to take care of their health in this pandemic. Before COVID, we still had a large population with many chronic illnesses such as diabetes, hypertension, And so what we're finding is many people are neglecting their care. And what we're working to do is get people back into the clinic to get the care that they need and avoid emergency care. So what we do is when someone calls in to inquire about testing, we talk to them. And there was a slide that I had up earlier that talks about, tell me what's going on at home. Many of our visits start off with that question because we know that it's not just coming in because you don't feel well. We know that there's a lot of other factors that my colleagues alluded to that are part of that person's quality of life that impact their health. So currently what we're doing now to keep these in-visits going is we're investing in purchasing room sterilization equipment, creating new check-in protocols. We're promoting heavily in-person visits. Our behavioral health line is still highly maximized via telehealth. And really at the end of the day, our goal is to prevent early deaths. I mentioned earlier that we were founded in a crisis. We still need more testing. We still need more PPE and more outreach and prevention to contain the spread. But we know that in this crisis and with your support, with our dedication, resilience, and trust, we will all rise to the challenge and create new and improved strategies to create a better new normal for all. Thank you again, and we really appreciate your generosity and your support for the families that we serve during this economic and health pandemic.
Thanks so much, Anna. And obviously, you know, a question is, how can you help? How can any of us help? Thanks to everyone on this call who has contributed to the San Diego Foundation's COVID-19 Community Response Fund, or thank you to any contribution you've made to help support the nonprofits who are doing all this great work. So give to your local charities. General operating support is great to help them have trust in the nonprofits that we have in this community, which are so great and know how to do the work that needs to be done to help our most vulnerable populations right now. Support the grantees of the COVID-19 Community Response Fund, the ones you heard today. Our website also has a list of all the grantees so you can see who has received funding, and they're all doing great work. And then you can still give to the COVID-19 Community Response Fund at sdfoundation.org/COVID-19. I hope we can all agree after hearing the inspirational stories today from our panelists, the impact that fund has had and hopefully will continue to have. So obviously it was time for Q&A. We've run a bit long, but thank you. And I know we've had some great chat on the chat section and some good conversations. If you do have any questions for any of our panelists, any of us here at the San Diego Foundation, please email info@sdfoundation.org. We'll triage all the questions and we'll get them to the right people and get you connected with either a panelist or someone on our side who can answer the question you have. And this is usually where Mark gives his closing comments, but again, I hope you all don't mind me as the understudy for the day, and I appreciate everyone taking the time to be with us. So thank you to our speakers, Kim, James, Ramla, Anahid, Anna. On behalf of the board and the staff of the San Diego Foundation, thank you for inspiring us each day with your compassion and the critical work you do to help San Diegans in need with support and a path forward. To those of you who joined today, thanks for listening to these community leaders and learning more about the impact and their challenges. You know, their challenges are our challenges, and lifting up those who are suffering in our community is some of the most important work any of us can do. So thank you again for joining. A recording of this webinar will be available on our website this week. And again, if you have questions, please feel free to email them at info@sdfoundation.org. Thank you again for joining, and have a great day.